if that high level is here to stay. Some fear that people will need yet another round of booster shots every few months. That would be bad news for billions of people in developing countries. Most of them are still desperately waiting for their first COVID shot.
All right, let's try to boost our knowledge of what's going on in this pandemic. And to do that, I'm joined tonight by Dr. John Campbell. He's an educator on health and is based in Carlisle in the UK. Dr. Campbell, it's good to see you again. It seems there might be a dilemma here, a moral imperative to provide vaccines to everyone in the world. But I'm wondering, is the medical imperative for booster shots, is it equally as important?
I think it is, and it'd be wonderful to think that these vaccines would automatically go to poorer countries if they weren't being used here. But as you've already said, pragmatically, that's probably not the case. Now, the data we have has just been published by the UK government. After 2 doses of Pfizer vaccine, after 3 months, we enjoy about 90% protection against symptomatic disease. But after 6 months, that goes down to 65% protection. And it's even lower with the Oxford AstraZeneca vaccine. But what's probably more important with severe disease and potential hospital admission, with the Pfizer vaccine, after 2 doses, 3 months after the second dose, the protection is very high, about 99%. But then after 6 months, that wanes down to about 90%. And again, the figures are even lower, as we've said, for the Oxford AstraZeneca for those parameters as well. Now, that reduction from 99 to 95% might not sound a lot, but if we reduce the efficacy against severe disease from 95 down to 90%, that actually doubles the amount of hospitalizations in people that are already vaccinated. And the other really important evidence here comes from Israel. This is just recently published a few weeks ago in the New England Journal of Medicine. And this, as your guest has just said, that after the booster dose, the amount of antibodies goes up by 10 times. It's a massive increase in the amount of antibodies compared to the second dose of vaccine. But more importantly, and practically, there's an 11.3% fold, no, not 11.3%, 11.3 fold, 11.3 times reduction in the risk of infection, and a 19.5 fold reduced risk of hospitalization and death. So you're almost 20 times less likely to get hospitalized with severe disease after you've had a booster dose. So the efficacy is clearly there.
Dr. Campbell, what you're saying tells me that, yes, we all will need a booster shot, and yet we're seeing such different recommendations from Israel, here in Europe, in the United States. Is there a best practice protocol that should be followed, or are we making it up as we go along in this pandemic when it comes to booster shots?
Well, of course, there's always a risk-benefit analysis in this, and it looks like the adverse reactions and side effects after a third booster dose are comparable to those after a second dose. And they basically, while it can be bad for some individuals, are basically considered to be acceptable. Now, there are different approaches to this, but actually quite a few nations, as you mentioned, the United States, Canada, Germany, quite a few European countries, the United Kingdom, are all introducing this booster dose program. And I think there's kind of evidence that you're 11 times less likely to get infection if you're boosted, and nearly 20 times less likely to be hospitalized if you're boosted, has got to be repeated in other countries. The evidence from Israel will be repeated in various countries around the world. This will be taken on by governments. And I believe that booster doses will be used in most westernized countries, starting with the older people, starting with those more at risk with comorbidities, those in institutional settings. But as is in the case with Israel, going down to all adults over time. And in Israel, all adults are now eligible for a booster dose, and well over 40% of adults who've had 2 doses of vaccine have already had a booster dose in Israel. And I think inevitably this is the way it's going. It's disappointing that this is necessary. We'd hope the immunity would last for quite a bit longer, but this is where we're at.
I'd like for you to take a listen to what the WHO's Europe director said today. Take a listen.
So why has Europe and Central Asia been experiencing soaring cases for 4 consecutive weeks? There are 2 reasons. First, insufficient vaccination coverage, and second, the relaxation of public health and social measures.
Dr. Campbell, he's pointing the finger to exactly where you are, the UK. The UK has had a very good record when it comes to offering vaccines and vaccinations, but it has also gotten rid of all the COVID restrictions. Is that now proving to have been a mistake?
Yes, I think we've relaxed far too much in the United Kingdom. Now, no one's talking about reintroducing lockdowns, but simple measures like mask wearing in public areas, simple measures like encouraging social distancing, increasing ventilation, simple measures like encouraging more people to work from home can have a really quite significant difference on this. So I really feel we do need to have this sort of two approaches here. The vaccinations need to continue. The booster shots are going to be necessary. But as well as that, we do need to somewhat tighten up on our social regulations. In the UK at the moment, it's almost like the pandemic never existed. Hardly anyone wearing masks in trains and public places. People pretty well seem to have gone back to normal. And it's just too early for that because this is resulting in increasing numbers of hospitalizations. And as autumn comes on, people are inside more, less vitamin D in the sunshine, more social interactions inside, windows are closed because it's too cold. There's inevitably going to be more transmission, and a proportion of those people, even if they're vaccinated, are still going to be hospitalized. So we do need this twin track. Now, I think the numbers of this pandemic are going to go down, I'm hoping, really dramatically at the start of next year. But for now, we've got to stop the surge in hospitalizations that is still a risk, and that involves vaccination and it involves social restriction measures as well. But that is attainable, I believe, short of restrictive lockdowns.
And we can throw in today in the UK the announcement that the UK has become the first country to approve a drug, a pill, that actually treats COVID-19. Is that going to be, not as effective as the vaccine has been, but is it going to be what we need to ensure that November, December, January are not as bad as they were last year?
It's a really good question. I think the autumn months can be better than they were last year because we are so much better vaccinated if we just have small amounts of social restrictions. Now, this molnupiravir is a capsule that people would take for 5 days. It needs to be taken within the first 5 days of a person being symptomatic. It does seem to be quite expensive. In the United States, it's about $700 per course. But the big advantage of it is it's taken orally, so it can be taken from home and it's not taken intravenously. Like monoclonal antibodies are, for example, in hospital situations. It would be given to people who have one or more risk factors for an adverse outcome, because there's data that shows that there's about a 50% reduction in the likelihood of going to hospitalization. But I am a bit surprised that the UK has authorized this as quickly as it has done. Now, the problem is there's a big lack of public domain information on this. What we know from the trial is that was a press release by Merck, so that's fine. We've got that press release, and now we've got a press release from the UK government. And the UK government are quite effusive in their praise of this, saying it's efficacious and it's safe and it's going to be implemented widely. But until there's more safety data, particularly in the public domain, really, the whole world scientific and medical community is not in a position to comment on this. At the moment, we just have to take the word of the pharmaceutical industry and the MHRA that have regulated this and approved this in the United Kingdom. So we're kind of itching to see more data on this, because there is a theoretical reason why this might be a problem. The way this drug actually works is it substitutes one of the bases in the RNA for an alternative molecule that causes multiple mutations in the virus and makes the virus non-viable. Now, some scientists have questioned whether it could also cause mutations in human cells. Now the Healthcare Regulatory Authority in the UK have said it's safe quite unequivocally. We can assume they have access to an awful lot more information than you and I do. But until we see this information in the public domain, we really can't pass peer-reviewed judgment on it.
Yeah, that's an incredibly important point that you make. And it also reinforces the point that tonight, the best weapon we have against the virus is and remains the vaccines. Dr. John Campbell, as always, good to see you. We appreciate your insights. And let's hope that this positive outlook, let's hope it proves to be true. Thank you.
Indeed, Brett. Thank you. Thank you.